My name is Laura Ramos Petersen, and this work was developed by my colleagues and I from the University of Malaga, where currently I am a lecturer. It's titled Relationship between Kinesiophobia, Foot Pain, Foot Function, and Disease Activity in Patients with Rheumatoid Arthritis. Rheumatoid arthritis, or RA, shows high prevalence and morbidity worldwide. Epidemiological studies demonstrated that RA is one of the most common autoimmune diseases, showing a prevalence between 0.5 to 1% of the general population. To understand rheumatoid arthritis, it is a multifactorial disease, including genetics and also environmental factors. Focusing on genetics, it's important to point out heritability within families, showing between 40 to 50%, is most common in women than men, and incidence rises with age. Focusing now on environmental factors, we need to point out diet and smoking. RA is characterized by chronic inflammation, and this shows some consequences in the short and in the long term. Focusing on the short term, we need to point out pain, which is the most common symptom that patients suffer and is the most debilitating one, and also joint swelling. And to be typical from RA, needs to be symmetrical and start by the small joints, such as from the foot. In the long term, chronic inflammation causes progressive damage of the synovial joints. This progressive damage leads in the loss of joint, of space, and deformity. And this deformity leads in functional deterioration of the locomotor system. Also, patients with RA suffer from synovitis and bone erosion. And all of this consequently, plus extra-articular manifestations. And the consequence is that patients with RA suffer from fatigue, psychological distress, their quality of life is decreased, and on top of that, sedentarism. Now, focusing on the foot and ankles, we need to say that foot symptoms are very frequently and very severe in those patients. They suffer from foot pain, joint stiffness, deformity, and loss of foot function. The consequence of all of this is that the patients suffer from kinesiophobia, which is the fear of movement. Also, they suffer from a loss of independence and psychosocial impact of impaired self-image, sexuality, and also personal relationships. Talking about treatments of all of those consequences that I am mentioning, we all know conservative treatments such as foot orthosis or pharmacological treatments, but there are other interventions such as physical activity. Physical activity and exercise has shown to be an effective and healthy intervention to improve their symptoms, including physical but also psychological effects, which means that also the depression symptoms are improved with physical activity. But which was the problem that we had some years ago? It was COVID-19. So that means that in general population, but even more in patients with rheumatoid arthritis, the level of physical activity drastically decreased and the sedentarism lifestyle increased. So in that moment, we point out the necessity of carrying out a study, not only focusing on statistically significant data, but also we saw the necessity of asking those patients about their feelings. So we thought that it was important to understand those patients. And we thought about two objectives. First, to explore the experiences of patients with RA during and after a period of inactivity, and also to determine the level of kinesiophobia relating it to pain. Therefore, to answer those objectives, what we thought is to carry out a qualitative study, but on top of that, we collected some quantitative data, being the visual analog scale for pain and the Tampa scale of kinesiophobia for kinesiophobia. The patients were, the sample size was collected from the Hospital Virgen de las Nieves in Granada, Spain, and from the interviews were carried out from January to March in 2021. The interviews were by phone because obviously we didn't want to have face-to-face contact. To be included, patients needed to be older than 18 years of age, with RA diagnosis and the ability to communicate themselves in Spanish. If patients presented dementia, other rheumatic diseases, cardiovascular diseases, or lower limb surgery or amputation, they were excluded from our study. This is what we wanted to address. We wanted to answer this question. What were the physical activity levels and health status of people with rheumatoid arthritis during and after the COVID-19 induced quarantine? Because I forgot to mention it before, but in Spain, we weren't allowed to leave our homes. In other countries, I know that they were allowed to practice physical exercise, to go around for a walk, but in Spain, that was totally forbidden. We couldn't walk. Only if you had a dog, you could take a walk, but that was the only thing allowed. And to answer this question, we developed a structured interview, and those questions were based in that questionnaire, the Tampa scale of kinesiophobia. The results were analyzed using the thematic analysis described by Clerk and Brown in 2017, and we used the Enpodhe software to help us with the process. What we did was to transcribe all the interviews. We analyzed line by line all the things that our patients said. We extracted some codes, and from those codes, we finally extracted some themes. The quantitative data was analyzed using a linear regression model using the SPSS software. Now those are the results. To have a better understanding of them, we are going to separate them between quantitative and qualitative. Focusing on the quantitative sample, we included 124 patients. 91 of them were female, with a mean age almost 60. They were between 38 to 81 years of age, and with an RA duration between 3 to 48 years. Focusing on the qualitative data, we interviewed 23 participants. 18 of them were female, and the mean of age and the RA duration was really similar. Focusing on the quantitative data, what we need to point out is that there was a significant relationship between kinesiophobia and pain, including general and foot pain, which means that if a patient presented high level of pain, that patient also presented high level of kinesiophobia. And that's really important because we can use this as a predictor in our clinics with our patients. So if a patient presents high level of pain, then we can suppose that the patient is going to have a high level of kinesiophobia, therefore is not going to be willing to go for a walk or is going to pretend to move the less possible because of their pain. Now focusing on the qualitative data, we extracted 4 themes, being physical activity detriment, health detriment, social implications of COVID-19 pandemic, and vulnerability of testing positive for COVID-19 due to rheumatoid arthritis. To make it clear all of the results, even though all of the participants said that physical activity was really important, and especially really important for the disease, to feel better with the disease, they all said that their physical activity levels were really, really low. So they know what they need to do, but they don't do it. They also felt a lot of kinesiophobia, also as they were really scared of doing some things for going to the hospital, they stopped their lives. For example, I remember one participant which said that he avoided all the stairs. He didn't want to climb any stair because he was really afraid of falling and then going to the hospital. And talking about vulnerability, that was a bit tricky because they didn't know how to feel about that. They didn't know if they were more vulnerable for the disease or they were wrong. Maybe some of them thought that due to their treatments, they were stronger against the disease. Talking about the limitations of this study, we need to point out that primarily the sample size was made by women. I also mentioned before that this is a most common disease in women, but also all the studies, previous studies, concluded that women with RA are more sensitive to present psychological consequences. Talking about future lines of research that this research opens is that we need to keep investigating, including more homogeneous participants, and also we find it important to include the effectiveness on biological treatments because they might influence, the biological treatments might influence the results. And answering the objectives that we proposed at the beginning of the presentation, and like the key messages that we can take home is that physical activity should be promoted in all of the patients with RA, even in challenging times, such as a pandemic. And the level of pain is related to the level of kinesiophobia in patients with RA. Thank you so much for your attention.
Thank you.